often in healthcare and particularly in digital health, we've got very good at building solutions that keep the healthy people healthy, those wellness programs. We even have great solutions for pretty health literate people to receive more coaching and information on their chronic condition. But I think one of the questions that we get asked a lot by health plan executives is, how do we build solutions that can engage those higher risk members, those who are driving the majority of costs, who are driving the majority of care gaps? And so the question that we often ask back is, what do we think the typical uptake, usage, and ongoing retention of high risk members in digital engagement programs or digital gap closure programs are? And unfortunately, it's a little bit disappointing. And any health plan executive who's tried to run a program with those high risk members is probably aware of this. Sometimes we do a poll and we get some really interesting kind of varied results here. But typically we see around 10% of members enroll out of that high risk cohort. About only 14% of them are actually actively using the program on a daily basis. And typically they only stay engaged for about 5 days and then they drop off. These are really disappointing results, I think, overall for most health plan executives who are looking at an engagement program to drive outcomes, to drive behavior change, to close gaps in care. And it's part of the frustration, I think, with digital solutions, particularly in the Medicare, Medicaid space, where the concentration of those high-risk members is significant, and the impact is significant. That there's a lot of frustration. Really, that's when we kind of think about what would an ideal member engagement solution look like. It needs to have proven outcomes with the high-risk members, those who are dictating the majority of healthcare costs, those who are frequently turning up in those gap closure lists. Those we need to be able to engage with them proactively and daily. And we talk about daily engagement a lot, and we do believe that the best way to drive outcomes with those high-risk members is through daily and proactive engagement. And obviously, we need to implement it at scale across millions of members. And I think that is the challenge. I mean, I think you can probably tick those first two boxes, maybe not daily with something like a case management program or a care management program. But then being able to scale it to as many people as you want is a frequent challenge for health plans trying to really move the needle on care costs and care gaps. And that's really what we built at Perx. And Kelsey will obviously take us through the day-to-day experience for members shortly, but I just wanted to kind of give some flavor as to what are the outcomes and why we've built what we've built. Really, we've built Perx to be a digital health solution that can engage those high-risk members proactively, daily, and consistently. And those three things are all really important. So proactively, we need members to be coming to us to close gaps in care, as opposed to us trying to chase them. So an unwanted text or an unread email or an unanswered phone call is not engagement as far as we're concerned. We also recognize that high-risk members need to be engaged in their care daily. And even some care gaps, then when we look at HEDIS measures and star ratings, things like medication adherence are not measures that you can change with a one-off phone call or a one-off email or a one-off text. It's something that we need to build habit formation with those high-risk members to actually get them to really change their behavior to see results. And that requires daily interaction with those members to ensure that they're taking the medication properly, that they are managing their physical therapy or attending appointments as we need them to. And then the final thing I think is most important is consistently. We all saw that 5 days of engagement that is typical in digital health solutions. And ultimately, you can't drive change or long-term change if you're struggling to engage people for less than a week. And that's where we really focus. And so we'll show a bit more on the visuals of how we do it. But in terms of our theoretical approach, we really focus first and foremost on solving the engagement problem first. If we don't solve the engagement problem, everything else doesn't matter. And so what we use at Perx is short-term positive reinforcement, completing critical care tasks. And now the thing that we recognize is that not everyone is going to be motivated by the offer of more health information or more coaching. We need to provide a wide range of personalized motivators that can engage a whole population, not just those who are health literate or conscious of their health. So we use a range of positive reinforcers, things like rewards, streaks, leaderboards, social, and gamification to really drive engagement on a daily basis. And we see fantastic results. So the average member is using Perx 4 to 5 times a day, and 75% of our members are active in-app day in, day out. The next most important thing is once you've got that engagement, how do you deliver the care plan adherence? And so when we think about what we ultimately need to be driving in terms of behavior change. We need people to be sticking to the tasks in their care plan. And that might be taking the medication, it might be attending appointments or screenings, completing health risk assessments, or even completing physical therapy exercises. And really, that's where we focus on. Once we've got the daily engagement, how do we use that daily engagement to ultimately drive better outcomes and better compliance to those care plans? I'm just checking my screen is still sharing. Is everyone seeing this okay still?
Yep, you're good, Scott.
Fantastic. Fantastic. Just getting
Well,
a
I'm
bit
going
of
to
a
give you a
delay
time
on my
check.
end.
You can give you a
No
time check.
worries.
Come on, crack on.
I'll be quick. I'll be quick. I think the important thing is that translates to real outcomes when it comes to adherence. And so we've taken a very robust approach to looking at how we deliver outcomes and particularly around adherence, because we know it's a focus for a lot of health plans. So this was actually a randomized control trial we ran with a leading university that was published in both the British Medical Journal and the American Journal for Managed Care, which found that Perx members were 4 times more likely to be adherent than those receiving standard care. And I think probably most important to people in the Medicare Medicaid space is this was a complex population, incredibly complex social determinants of health, and 65% of people who were non-adherent at the start of the study in the Perx arm became adherent with Perx over the course of 12 months. And so directly linking back to those important HEDIS medication adherence measures. Once we've got that engagement, people are coming in, day out, and people are completing healthcare tasks and adhering to their treatment plan, gives us a huge ability to spin the engagement flywheel. And so when someone's coming in and taking their daily medication using Perx, it's very easy for us to get them to complete a health risk assessment or arrange a diabetes screening. And that's where I think we can kind of start working in one particular area of care gap closure and very quickly stack on others. And it's part of the reason, by taking that kind of daily, monthly, habitual approach of people engaging with Perx, that we see the longevity in our programs, that we see the average member engaging for over 220 days. And that's 44 times longer than typical digital health. And that's really how it works. We can drive that positive daily motivation. We can have a massive impact on the adherence to their treatment plan and their medications, which not only drives clinical outcomes as evidenced in multiple peer-reviewed studies that we've published, but also can really drive both quality and financial outcomes for the health plans and healthcare systems we work with. And with that, I'll throw over to Kelsey to run us through a demo.
Thanks, Scott. Whilst Kelsey's bringing that up, oh, there you go. If you have any questions, ping them to me in the chat and we'll make sure we answer them at the end.
Perfect. All right, everyone. Well, I'll go ahead and hop in. Really, when you log into the Perx app, you'll see your daily health to-do list. So kind of one of the beautiful things about Perx, and that Scott touched on, is that it is extremely customizable, and it's customizable to the person and to the program. So their daily task can be anything like, blood glucose, so biomarker measures, medications, refill reminders. It can also be things like education or surveys. So a HRA or a social determinants of health. We even have things like daily activity trackers or adding, wellness tasks like meditation or drinking your water. The really gives this person the ability to manage any and all healthcare tasks when it comes to managing their chronic conditions and managing their health. And it also gives the opportunity for the health plan to make sure that they have their members completing the tasks that they need to complete, again, to help manage their health and improve their health outcomes and close gaps in care. So when it's not enough just to have a nice looking to-do list to get people to do these things. So there's a few different kind of behavioral science bells and whistles that are going on in the background to make sure that people are going to be motivated to come in every single day, month after month, year after year. When you do complete a task, for example, a medication task, we can require photo verification for that, verify that they've actually taken those meds. When they complete that task, a few things can happen, one of which is a gamified experience. This one is a particularly challenging one in my mind, but these games are random, and the actual rewards that you may or may not get from these games are randomized as well. And that's part of the reason why Perx works, is that randomization. I wasn't really paying attention. I'm going to choose the middle one. Lucky for me, I actually won this game, which is really exciting. So again, that randomization is part of what gets people excited. And I'll get into the rewards in a little bit. But the individual has that opportunity to earn Perx points, to play that game, to earn a reward throughout kind of completing these tasks. And it gives kind of different types of motivators for those different types of people, because there is no silver bullet that works for everyone. When it comes to some of those intrinsic and extrinsic motivators that we have, you saw some of them on the by completing a task. One here is your level. So as you complete healthcare tasks within the Perx app and continue on day after day, you earn more points and you increase that level. So this is one of those intrinsic motivators that people like to see. It goes up over time, but it's not just a vanity metric. It actually directly correlates with their ability to kind of customize their experience. So when it comes to rewards, there's a few things to call out here. These are completely customizable on a program by program basis. So what that means is sometimes we plug into existing types of rewards programs that might be available to the member that's sponsored by their health plan. We know that within certain Medicare, Medicaid specifically, there are certain types of rewards that we would not want to be offering. So we want to make sure, and Perx does control everything when it comes to the dollar amount of the rewards, the types of rewards that are given, and the types of tasks that rewards are given for. So all of that is going to be maintained so we're up to your specific health plan's needs and any type of program parameters there. But when it comes to the ability for that individual to kind of manage the rewards here within Perx, that's done in a few ways. So I'll call out a few things here, one of which is those hearts at the top. So when an individual completes all of their healthcare tasks for a day, they earn a heart. This can act then as a bit of currency. It gives them the ability to unlock different types of rewards that are available to them. It also, I said that level wasn't just a vanity metric. As you increase in that level, you actually unlock different types of rewards as well. So again, it's that kind of long-term motivation tools that we have here to get those individuals to come in and to get excited day after day and complete any and all healthcare tasks. This gives the opportunity for them to unlock the ability to win those rewards. It's not giving them that reward, but when they do complete that task, again, now that I have a chance to get that coffee that I'm really wanting, a little treat for me. All of those rewards are redeemed here in app, and they can be accumulated over time. So a key factor in terms of rewards and really how Perx works, while rewards are exciting and they're definitely motivating for a lot of individuals, especially coming into the program, a full 30% of our long-term users have actually never cashed in a reward. And that really goes to show that they're coming in for the long term because of the other various factors within the Perx app. So it's not just a type of rewards program. There's other kind of tools that are really getting those individuals to change their behavior and actually change that behavior for the long term. One of those that's really exciting for people that they love is your streaks. So I, just started my streak of this program, but when you complete all of your daily tasks, you start your streak. And we have people that it's not, I lost my password and I have $30 of the rewards. It's, I lost my password and I don't want to lose my streak. So those folks who are really motivated by that kind of intrinsic motivation. We also have our community. So for those individuals that really want to interact with others and are really want to share their wins or share healthy living tips, this really acts as a public forum for them to share that over time. We actually had an individual share that they had a 1,000-day streak, which is pretty exciting, especially for an individual that was managing multiple chronic conditions, that they were staying adherent to their treatment plan for over 1,000 days, which just goes to show the power that Perx can have on an individual level. For those that are a bit more competition minded and competitive focused, we do have our leaderboard. So you can see how you're stacking up against the competition of individuals that are in a similar place in their Perx journey. So you're not going to see someone new next to an individual with that 1,000-day streak. It's that positive motivation and reinforcement over time. while we have these kind of daily tasks, and again, these can really be customized per program and per individual, we also make it really easy for an individual to add tasks and for those tasks to be kind of preloaded as well when they come onto that program. So for an individual, we can add all types of tasks when it comes to medication, exercise therapies. We can even set goals when it comes to, general health goals, or create custom tasks that you want to have for yourself. So it's really meant to be this all-in-one place that an individual, especially those members that are managing multiple chronic conditions, that have complex treatment plans, that don't have one solution. They've been giving many point solutions. They've been given many people that are calling them, but not something that's simple and motivating and easy to use for them to take control of the treatment plans that are already given to them. An individual can also see how they're kind of tracking over time when it comes to their health insights and measurements here in the Health Hub. We also have the Health Hub here as a place that you can have evergreen resources provided to your members. So while we have kind of daily tasks that we can push out, so that could be an education module that we want them to complete, it could be getting them to get their flu shot when it comes to flu season. But if we have different kind of access points, like a crisis hotline or a login to their member portal, or even something about their benefits, we can actually have that here in the Health Hub. And by getting members to come in, 4 to 5 times a day, every single day for over 6 months, there's a lot of opportunities for them to engage in other types of programs or offerings that that they have available to them that they wouldn't be really engaging with otherwise. So this is a great place for us to be able to do that. When it goes over to our account, this is where an individual can manage their medical conditions. We also make it really easy for them to actually share their health information. So if you put in an email for an individual, this could be a caregiver, a doctor, or really anyone that an individual wants to share this information to kind of better their health, they can do that and they get that access to their Perx Health data. It makes it really simple for them, especially for individuals that might have a case manager or a doctor that wants to see this type of data, and they can see that very seamlessly and easily. The last kind of piece of the puzzle here, we do make it really easy for individuals to get support within our messaging within Perx. We have real live humans as well as automated Q&A for them to get the support that they need. We can send those messages. We can also kind of escalate as need be when it comes to individuals needing other types of care. So if they do write into support, we work directly with the programs and our clients to make sure that they're getting the type of support and escalation when they are utilizing Perx and they write in for that. So all in all, I've gone through, a lot about Perx today, but I really want to highlight just the ability, again, for that there is not that one thing that works for everyone. I think that you can all understand and realize that. And that's what we've done here, is really encompass all of the different types of motivators that work for a wide variety of people. And that's why we're able to scale across conditions, across socioeconomic types and different types of social determinants of health, and really get that ability to improve health outcomes for the long term. So definitely happy to run through anything else, go through any questions here with the last few minutes that we have here.
Kelsey, amazing as always. Thank you very much for that. A couple of questions. I think, Scott, this one might be for you. It's about how Perx compares to the competition. So what's the biggest differentiator for Perx versus other digital health solutions? We're not the only one that does a rewards-based incentives. How is Perx different?
Yeah, I think the biggest difference is probably that focus on those high-risk members. I think there's a big difference, and we've seen this with some of the research that's coming out on the diabetes management, the diabetes coaching solutions. When you think about a single condition management solution, you're capturing everyone from the high health literate people who can manage their condition just by simply making lifestyle changes, right through to those people who are frequently hospitalized with multiple chronic conditions, complex social determinants of health, and lower health literacy. I think Perx has been very explicit from the early days of really building a solution that can work for that 10% who accounts for 70% of healthcare costs. And they typically are not the ones adopting digital solutions as they are. They're not engaging with those solutions. And the stats show that when you see that kind of low enrollment, low engagement, low retention with digital solutions. I mean, Perx has now a number of both commercial case studies and clinical research that backs up the fact that we work best with those multiple chronic conditions, high risk cohorts. And it's effectively Perx we should probably think of more as digitally scaled care management or case management, as opposed to another digital coaching solution, because we think that there's different cohorts that respond better to different solutions. And ultimately where Perx is laser focused is on those really high risk members. And our engagement results and our clinical results prove that out.
Scott, I'm going to keep you talking. You said a number of programs there. We had a question about who's our current customers. Who do we work with? So just carry on from that.
Yes, we work with a number of health plans, including First Choice Health and also Allstate in their benefits team with their benefits team. And most recently, we've actually just signed a large national Medicaid plan. There'll be an announcement in a couple of weeks, and we'll be able to share the kind of name publicly. But yeah, we're launching across 10 of their states in the next couple of months. And so really a combination of both commercial plans and Medicare, Medicaid.
Again, nice segue. There's some questions about government-sponsored populations. So, Kelsey, do we have experience with government-sponsored programs? I think Scott touched on that, but also how do the rewards work in those government programs?
Yeah, great questions. And yes, we do have experience with it. And we really default typically to kind of the most conservative approach, especially when working with our clients. So we've done all of the research in terms of what's the requirement, both for like on the Medicare and then obviously Medicaid. There's national and then state by state varies as well. So in some of those programs, we again kind of tap into their kind of current rewards programs that they have. Sometimes we kind of lessen those types of rewards, also offer things like coupons. So there's a lot that we do in terms of customizing the reward experience to make sure it aligns and is adherent to that specific kind of client parameters or the kind of government sponsored parameters. So some again, plans are a little bit different than others in that they are, willing for us to kind of manage all of the rewards, and others they want to have them like kept in-house. So it's honestly varied a little bit state by state, but we do have the experience in getting it done.
Related to that, this person would like to know what's required to launch a Perx program. So what does it look like in implementation?
Yeah, well, the good thing is tech and security teams really like us because we don't require any deep technical integrations, and we can stand up really quickly. What that looks like is really just us getting an eligibility file. So working with your team to understand what actual members will be going after, getting that eligibility file. And then typically we create all of the like enrollment and marketing materials, again, working hand in hand with internal marketing teams to see, who's sending that, again, kind of following in the guidelines of our clients. But it's we've seen, I have our marketing team on that's going to keep me in check, but 4 to 6 weeks. We've done something in a long weekend, which definitely is not recommended. So I'm going to say 4 to 6 weeks is our typical stand-up time for kind of getting that approvals and then going live with the program.
I appreciate the 6 weeks, Kelsey. And Scott, probably the last one for you. You're going to love this. Someone would like to know about clinical evidence. Talk about throwing your bone. What clinical evidence?
Yes, I love to talk about clinical evidence, Hadley. I mean, I think the most important thing here we've taken from very, very early days is building out a clinical evidence base that is relevant to the populations we serve. I think in digital health, you often see some pretty spurious clinical studies out there that might be with a really small sample size in a really kind of biased population set. We've been really clear from the get-go that we want to have some really strong clinical data around our engagement, our adherence, our health outcomes, and our cost outcomes. with the populations that really move the needle. And so actually that randomized control trial that I shared earlier, we were recruiting out of public government-sponsored populations with low health literacy, with complex social determinants of health, several of whom we actually had to provide them with their first smartphone to be able to use Perx. And so we have a number of both features and capabilities to be able to work with those higher risk complex populations. We have seen phenomenal results, and that clinical trial was published in the British Medical Journal and the American Journal for Managed Care, two really well-regarded journals, looking at both significant improvement in engagement and adherence. That was the reference point I mentioned before, where the Perx arm were over 4 times as adherent to their treatment plan versus the control arm, and 65% of participants who were not adherent at the start of the study in the Perx arm became adherent by the end of the study. And so I think that's really, really important. We also saw biomarker improvement across that population in both diabetes and cardiovascular biomarkers, which is exciting to see. I mean, if you can get someone to be 4 times adherent to their treatment plan, it's probably not a surprise that they see real clinical outcomes. But I think that is really important. And then we've also spent a lot of time working with partners to build out the return on investment and cost outcome measures. And so with one of our partners in high risk psychiatric and musculoskeletal care, we saw over $6,000 in cost savings per patient, because we're really narrowing in on those high risk, high cost members. And so I think, happy to kind of share more detail about that, and thinking about what would the return on investment look like for your organization based on care gaps closed and cost savings. We do that with all our partners.
Thanks, Scott. I'm going to wrap it up there. Thank you, everyone, for joining today. Picture paints 1,000 words, and seeing a demo is even better. So hopefully now you understand intrinsically what it is we're doing at Perx, what the experience is like, and how it is that we get those amazing outcomes that I like to promote in marketing so much. So thank you all for your time. Enjoy the rest of your Tuesday. And thank you.
Thank you.
Thanks, Scott.